Hi, I'm Rachel Bosco. I'm an oncology dietitian and I've been with Savor Health for the past year. And today I'm going to talk to you about nausea. Nausea is that kind of queasy feeling in your stomach. It can make it very difficult to eat and it can also cause vomiting. So whether you're a cancer patient undergoing treatment and experiencing nausea, or maybe you have COVID-19 and you're experiencing some nausea, hopefully the tips today that I'm going to share with you and the recipe that I'm going to make can be beneficial for you. So first of all, if you're feeling nauseous, it's actually helpful to eat something. Going long periods of time can make nausea, without eating can make nausea worse. So maybe eating 6 or so small meals throughout the day can help with nausea. Secondly, you can try sipping on ginger tea. So whether you have a fresh ginger root that you're going to steep in some boiling water, or you have the packets of ginger tea, you can also even do ginger candies that are available in the store. Next, you want to try to have some bland starchy foods. Those are good with helping the feelings of nausea. So like crackers, a piece of toast, pretzels, those are all good foods to be consuming if you're feeling nauseous. You really want to avoid high fat, fried, greasy foods that can be more difficult for your body to digest. Next, you'll want to avoid laying down for about 30 to 60 minutes after you eat something because that can make nausea worse. And finally, you want to try to eat more room temperature or colder foods. Sometimes the smell of cooking foods and warm foods that are fragrant can make nausea worse. So today I'm going to make for you a recipe that is inspired by the blueberry ginger coconut smoothie in Savor Health's Meal to Heal cookbook. The great thing about smoothies is you can use whatever ingredients you have on hand. You don't have to follow a recipe to a T. So for this smoothie, I'm going to grab my NutriBullet, but you can use a blender as well. The recipe calls for a cup of blueberries, but I happen to have strawberries and blueberries fresh, so I just washed about a cup, and I'm going to put them in my NutriBullet. And next is a banana. Banana has potassium, so if you are experiencing nausea as well as vomiting, potassium is one of those nutrients that can become depleted. So adding a banana in there can help. And it also gives some sweetness without adding added sugar. And the blueberries and the strawberries I didn't mention are full of antioxidants, which is helpful to fight inflammation. So next, the recipe called for fresh ginger, which I unfortunately didn't have, but I used some of my crystallized ginger, and I just chopped it up, and I'm going to put that in the smoothie. Ginger has been used for centuries to help alleviate nausea and vomiting, so it's a nice thing to put in this smoothie. Next, we have 2 tablespoons of unsweetened coconut. That's going to add some fiber, it's going to add some more potassium, and some other yummy vitamins. Next, we're going to do 2 tablespoons of walnuts. Walnuts are rich in omega-3 fatty acids. They also have antioxidants, both of which to help fight inflammation. And that's important whether you're a cancer patient, a COVID-19 patient, or you're just trying to be healthy in general. And finally, the recipe called for coconut water, which I didn't have, but I do have milked cashews, so I'm going to use that for a little extra protein boost. And I'm just going to put about a half a cup in there. You can always put more or less liquid depending on how smooth you like your smoothies. And then I'm going to blend this up until it's the right consistency. And perfect. You have a quick and easy smoothie. It's nice and nutrient dense. You can get a lot of nutrition in with a smoothie when you're not feeling like eating much. Have a good day.